my name is Madeline. I'm a student nurse from Purdue University Northwest, and I'll be taking care of you today. Okay, so I just want to make sure that I have the right patient by stating your name, date of birth for me. Great. Are you allergic to anything that you know of? Whether it be food, environment, medications, or even seasonal allergies? Great. So I've already performed my hand hygiene. My PPE is on. I've identified the patient. My curtains are closed, door is closed, just to ensure that my patient has the privacy that they need. And everything is here at my bedside. My waste receptacle is right here, just in case I would need it. And so I've already assessed my patient for the non-pharmacologic pain-reducing interventions. We've already gone through those. He has everything that he needs. And we also administered medication about an hour ago. So pain scale is at a 1. So we are good to go. So the bed is adjusted. It's at my elbow height here. That's where I like to work. It's right at the height of the caregiver. And now I'm going to assist the patient into a comfortable position. Like I said, just right there. And so this also provides easy access to the wound area because the wound is on his foot. And I have a waterproof pad under the wound site as well. So when we irrigate the wound, it's not going to affect his sheets or anything like that. So now I'm going to put on a gown, mask, and eye protection here. Just because we are doing wound irrigation, we want to make sure that we have all the PPE necessary to do this. Just because there can be some like splashing back and things like that. So I have my gown. It's all tied up. And then I want to put on my mask. Make sure that's on the right way and tape it to my nose. I'll put it above my ponytail, make sure it stays up. And so after this, I don't need sterile gloves for this. So I can just put on normal gloves. Okay, so I'm going to go ahead and put on my goggles. And then my gloves. Okay, so now I'm going to gently remove the dressing now that I'm getting my gloves on. So if there was resistance, which there wasn't, I would put a silicone-based adhesive dressing or remover over the tape just to make sure it's not tugging on the skin or anything while I'm removing the wound. And I wouldn't adjust my face like that, but I did because it was uncomfortable. So after removing the dressing, I'm going to look for color, odor, discharge, drainage, if there's any redness or anything like that as well, because that would give us an idea if there was an infection or something like that. So I'm going to assess the wound also for appearance, stage, presence of eschar, granulation tissue, epithelialization, undermining, tunneling, and corrosive sinus tract and drainage. Assess the appearance of the surrounding tissue as well. We're going to measure the wound, make sure that it's not getting bigger or anything like that. All that is important. So now I'm going to remove my gloves and put them in the receptacle because now I'm going to go ahead and use my sterile gloves, which are over here. So you can't see this, but right now I am putting my non-dominant hand over the cuff of my dominant hand's gloves over the sterile field. Paying careful attention to my 1-inch margins around the field. I'm also now cuffing, well, not cuffing. I'm putting my right hand, which is my dominant hand, under my non-dominant hand's cuff here, like this. You can see, just to ensure that I put on the gloves correctly. Now I can adjust my gloves. This is my sterile field. I have all my wound cleansing supplies. I poured warm sterile irrigating solution into the sterile container, and I put on sterile gloves. So now I'm going to alternately I could, I don't even need to worry about that. So now I'm going to position the sterile basin below the wound to collect the irrigation fluid here. I'm going to fill the irrigation syringe with solution. I'm going to use my non-dominant hand here and apply gentle pressure to the basin against the skin below the wound to form a seal with the skin. And I'm going to gently direct a stream of solution into the wound, keeping the tip of the syringe at least 1 inch above the upper tip of the wound. And when using a catheter tip, insert it gently into the wound until it meets resistance, gently flushing all wound areas. So now I'm watching for the solution to flow smoothly and evenly when I'm flushing out this wound. When the solution from the wound flows out clear, continue irrigation, because any other color could indicate an infection. So dry the surrounding skin with my gauze dressing. Here's my gauze dressing. Apply a skin protectant to the surrounding skin. Apply a new dressing to the wound. And now I'm going to remove and discard my gloves and apply some tape, Montgomery straps, or roller gauze to secure the dressings. So most wounds will most dressings will already have tape to them, so you really won't need it. After securing the dressing, label it with a date and time, remove all remaining equipment, and place the patient in a comfortable position again. So my side rail is up, bed's in my lowest position. So now I'm going to remove my remaining PPE. So I want to take a bottom of my mask off first. And the top mask. And then my gloves are already removed. So I can take my gown off. So that's off. And I'm going to perform hand hygiene. And so I would also check the wound dressings every shift. More frequent checks may be needed. If the wound is more complex, or dressings may become saturated quickly. But that is skill 31-3.